Member Sanders for holding today's hearing. Also want to say thank you so much to each of our witnesses for being here and for presenting today. Now, as we discuss the importance of planning for retirement and having investment options for retirement, as well as other issues that this committee should consider, I'd like to ask just a few questions, starting with Mr. Williams. Earlier this year, the administration issued an executive order that would encourage 401k managers to offer private equity options in retirement portfolios. And one of my priorities here in the Senate is creating pathways to wealth for all of our families and to grow economic opportunity, especially younger constituents who have expressed their interest in planning for the future and building that type of wealth. Investments in private equity seem to appeal to many of them as I talk to them. So I want to make sure that our next generation's investments in their future are protected. And the idea that private equity investments may bring about a higher return on investment than what we would consider in a traditional retirement investment is debatable. These investments can come with risk due to different oversight and disclosure requirements, which could increase the possibility of financial loss. So do you see a benefit in these types of investments? How would you advise our young people, especially for those who'd be looking to invest early, and as private equity potentially becomes an option that more people are interested in, as we consider the impacts and opportunity of private equity and 401k plans, I want to know, what should we as a committee and as Congress as a whole be thinking about in terms of how we best place guardrails around these kinds of investments?
Senator Alsobrooks, this is an important question, and we share your desire to create American prosperity and help younger Americans save for retirement. And as a firm, we continually explore new products and services in our workplace plans so that they are appropriate, diversified, and transparent. And we are currently exploring how we can prudently offer alternative investments to clients. But I think the guiding principle is to make sure that our clients have a safe and transparent experience and a set of investment options. With regard to individual products, my approach as a practitioner is I treat it in the same way that a patient wouldn't come to a doctor. If a patient comes to a doctor and says, I want this particular medicine, or I don't want this particular kind of medicine, if they're a good doctor, they will say, well, maybe that makes sense for you, maybe that doesn't. But I'm more concerned about how it fits within the overall context of your wellness plan. And as a financial planning practitioner, I take a very similar approach. So if a client comes to me and says, I want private equity or I want alternative investments, my job, both as a financial advisor and a CFP professional too, as well, is to make sure that we're prudently offering products and services and they can make informed choices.
Okay, thank you so much. Now, Mr. Fiesta, when we're looking at how much seniors rely on Social Security for their monthly income, the numbers paint a really challenging picture. In my state, for example, approximately 30% of our residents age 65 and older rely on Social Security for at least half of their monthly income. And when you look nationwide, we know that 73% of seniors rely on Social Security for half their income. 22 million seniors rely on it as their sole source of income. And data tells us that even with Social Security, approximately 23% of seniors in the United States are living in poverty. Now, I was proud to join Senator Blumenthal and several of my colleagues to include Senator Sanders as an original co-sponsor of the Boosting Benefits and COLAs for Seniors Act that would base Social Security benefits on the Consumer Price Index for Americans age 62 and older, which is CPI-E, instead of the Consumer Price Index for urban wage earners. And I was also proud to join Senator Sanders and more than 170 of my colleagues in Congress to support Raise the Wage Act. So Congress has been debating the COLA change for several years, and I wonder whether you can explain the importance of calculating Social Security benefits using CPI-E rather than CPI-W.
Yes, Senator, we have, at the Alliance for Retired Americans, supported changing the COLA to what retirees spend their money on: food, fuel, and especially health care, the highest inflation components of our economy, including prescription drugs. This year, for example, the Social Security COLA January 1 will be 2.8%. Had we been using at the BLS the CPI-E, it would have been 3.1%. And most of the last 20 years, the CPI-E would have been 0.234% higher than what the COLA was. So you can compound that over time, and seniors would then have a more realistic income to pay for their basic necessities. And thank you for
Thank you.
co-sponsoring.
Thank you, Mr. Chair.
Now